Hello and welcome, everyone. Kaiser Permanente and the World Economic Forum welcome you to Connecting Climate Change and Mental Health, Impact and Hope. I am Shweta Chakraborty, CEO of North America for We Don't Have Time, the world's largest social media and communications company for accelerating climate solutions. Today, we will shine a spotlight on the profound connection between climate change and mental health. We will bring together, as we always do, leaders from diverse sectors to share valuable resources and insights for prioritizing mental health and equity, with a focus on the workforce, youth, and families. We know during our promotion for this event, this topic is of great interest to so many of you. In fact, during a recent poll that we ran on social media, more than 40% of the 7,000 respondents said that their mental health or the mental health of their friends and family has been impacted by a climate-related event. So with that, let's get started. It's my pleasure to introduce our first speaker, Shyam Bishan. Dr. Bishan is the head of the Center for Health and Healthcare, an executive committee member of the World Economic Forum. He has more than 25 years of global experience in healthcare, public-private partnerships, strategy development, M&A, and business development. He comes to the forum from the Bill and Melinda Gates Foundation in Seattle, where he was responsible as the regional deputy director for partnering to harness advances in healthcare to save lives. I turn this over now to you, Dr. Bishan.
Thank you so much, Shweta. Hopefully everyone can hear me well. Hello, everyone. We are delighted to welcome you to this panel event today, which is, as Shweta said, hosted by Kaiser Permanente and the World Economic Forum. We are connecting climate change and mental health today. My name is Dr. Shyam Bishan, and I head up the Center for Health and Healthcare at the World Economic Forum, where we have been helping to spearhead global efforts on two critical issues, on two critical topics, which are dedicated initiatives on climate and health and mental health. There's no question that climate change is having a devastating effect on our environment and on our communities. One often overlooked aspect is the impact climate change has on human health, and within this, the mental health. According to 2023 IPCC, which is Intergovernmental Panel on Climate Change, there is a very high confidence that rising global temperatures will lead to an increase in mental health hazards. Yet, governments only allocate around 2% of their health budget to mental health. This needs to change. This needs to increase as climate change intensifies. With mental health issues holding back millions of people every day, it's crucial we understand how climate change might affect our mental health. Just a few words on how can climate change impact our mental health here. We know that climate change is leading to more frequent and extreme weather events, such as floods and storms. People living through these can be exposed to potentially traumatic events, such as witnessing serious injury or death of loved ones. As a result, many people will experience higher levels of psychological distress and anxiety. Climate change could even lead to post-traumatic stress disorder, PTSD, according to some research. It can lead to aggression, it can lead to gender-biased violence, and even suicide. Focusing just on the impact of heat waves and mental health, we know that hospitalizations for psychiatric disorders and emergency psychiatric visits tend to increase during heat waves, during really hot days. Rates of suicides have also been shown to be higher during heat waves and are expected to increase. Heat can also disrupt sleep, and poor sleep can worsen mental health problems. Extreme weather events can also have impact on some of the social and economic determinants of mental health by leading to unemployment, homelessness, or food and water insecurity. This can also be detrimental in people's mental health. A recent study reported that young people are factoring climate anxiety into their decision on whether to have children. with 97% saying they were concerned about the well-being of children in the future. What is clear here is addressing the mental health aspects, addressing the mental health impacts of climate change requires a global and holistic approach. It must combine all our expertise, every sector, every industry, every region, every country. Everyone must come together to tackle this issue. It must promote resilience, build supportive communities, provide mental health resources, and foster climate action to mitigate the impacts of climate change and protect mental well-being. Today's panel is designed to shine a spotlight on the profound connection between climate change and mental health. As Shweta said, we have brought together leaders from diverse sectors to share valuable resources and insights from prioritizing mental health and equity with a focus on workforce, youth, and families. With this, let us move on to the panel discussion, and let me hand it back to Shweta to take the session forward. Thank you.
Thank you very much, Dr. Bishen, for your welcoming remarks. It's now my honor to welcome our next two speakers. We have Dr. Bishara Shuker, who is Executive Vice President and Chief Health Officer at Kaiser Permanente, where he oversees the organization's community health, social health, and Medicaid portfolios. Dr. Shuker brings a public health lens to implementing innovative programs that address the greatest threats to health. We're talking about gun violence and homelessness to food insecurity and climate change. Under his leadership, Kaiser Permanente has become the first healthcare organization in the United States to achieve carbon neutral status. Joining Dr. Shuker is Hawaii Governor Dr. Josh Green. Governor Green has been recognized for his leadership in healthcare, providing health insurance for every child in the state of Hawaii. He also helped spearhead the creation of the Cancer Research Center, passed groundbreaking anti-tobacco legislation, and created a statewide trauma healthcare system. In July 2022, Governor Green created the Office of Wellness and Resilience to break down barriers that impact the physical, social, and emotional well-being of Hawaii's peoples. One goal of OWR is to establish trauma-informed responses to community traumas and natural disasters. Dr. Shuker, I hand it over to you.
Thank you so much, Shara, and it's so great to be with you all today. There is no question that climate change is having devastating impact on our communities, on our environment, and there is no question that climate change is impacting health, and that also includes mental health. We have seen links between climate-related events together with anxiety, grief, depression, violence, and even suicide, which brings us to today's fireside chat with Hawaii Governor Dr. Josh Green. Dr. Green, it is so good to be with you today. How are you this morning? Really early this morning.
I'm great, but I'm so pleased to be with you. I'd come onto this panel any hour.
Well, thank you so much for here. And maybe we'll start. I know we're going to dig deep into the mental health implication of climate impact, but maybe we'll start if you tell our audience what happened on August 8, 2023.
Thank you. So first of all, I should say mahalo or thanks to the whole planet for reaching out to us and helping us to heal after the Maui wildfire on August 8th. It was a tragedy of epic proportion driven by climate change. What basically happened was we had a dry season, and we've had a lot of dry seasons because of climate change in the last decade. And then we had a hurricane, which we expect to have hurricanes during hurricane season, but a fire broke out because of dry conditions. The winds from the hurricane swirled between 74 miles per hour and 80 miles per hour. And fire, which first started in Lahaina, then spread to other parts of the state, ultimately cascaded down the mountainside and destroyed, took 102 lives of our loved ones, and it destroyed over 4,000 structures, approximately $5 billion of damage. And as you can imagine, it traumatized an entire community and state. So we had not ever seen anything quite like this. We've seen wildfires. I've been, near wildfires when I was living on the Big Island as a physician, but I'll tell you, It was extraordinary. And I could relay stories, for instance, of a 15-year-old who had never driven before, but had to dive into his car with his family and drive the car for his first time, escaping flames that were lapping up against their vehicle. Of course, some people saw their loved ones pass away. A 79-year-old gentleman couldn't get his 69-year-old wife of many years out of their house because she had had a stroke years before, and he knew that she was going to perish. I mean, the stories are catastrophic, and it resonates across the entire community and then the state, because in Hawaii, everyone knows everyone. We have 1 degree of separation, not 6. So you can imagine what it does to our mental state. And we are seeing spikes in depression, anxiety, and PTSD.
Well, this is heartbreaking, which brings me to really my first question around the impact that you've seen, the psychological impact of the fires on individuals and on communities. Can you kind of describe a little bit more of what you're seeing in that space?
Yes, it affects us as individuals, of course. What we've seen is historically, we've had a baseline, like everyone, of behavioral health challenges, whether it's depression or addiction, in the 20 to 30 percentile range of our society. That has spiked to over 50% for those that were directly affected by the fire. And it spreads out because for now, we are now struggling with housing, for example, and housing insecurity as a result of the fires is very, very challenging. And it doesn't just affect the 13,000 individuals that were displaced. That was just over 3,000 families. It affects everyone on the island or in the county of Maui, because now prices are twice as high. People are having that much more difficulty having a stable housing situation for their families. That means there's economic challenges because costs are higher. So there's a million different ramifications of a disaster that occurs like this. And also, we just started fire season again. So people will, of course, perseverate on what happened before. Will it happen again? Do we have enough new protection, which we have a lot of new protection, as you can imagine, through technology and additional firefighting resources and fire breaks? But that doesn't necessarily prevent a person's well-being or psyche from being able to cordon off or keep away the fear and anxiety. As we all know, the very nature of behavioral health issues, mental illness, are that they are deep. They run deep. They don't just get cured instantly because someone gives a magic pill or puts up a new barrier. So it's a very big deal. It will resonate for a generation here in Hawaii. And what I'm here to do with you and everyone that gives me an opportunity is to share this cautionary tale. We have to get ahead of the impact of climate change, because if you don't, we will have these disasters, which will have a profound effect on all communities and societies, all communities, not just some. And we haven't even yet begun to discuss the implication for nation states that are islands that are seeing existential challenges because of climate change. So all of these things are here to stay, but we can make good decisions to protect ourselves from these events. And we can also, of course, provide extra care. That's why we have become a trauma-informed state, and our Office of Wellness and Resiliency is so important.
Thank you. And obviously, Governor, in these types of catastrophes and disaster, it takes all of us. It takes all government approach. It takes all communities approach. And we've seen the government respond, your local governments, your state government, the federal government. We've also seen the community stepping up. We've seen the private sector stepping up. Can you just share some of the highlights of what you've seen has worked from a government perspective, as well as from community and private sector response?
Yes. So accepting the fact that a disaster has occurred, everyone stepped into the fray to help. Within 13 days, we moved everyone from congregate shelters, like gymnasiums and such, to hotels. Hawaii is unique that we have everyone has a shortage of housing in some way or another, it seems these days, but Hawaii's housing market is critically constrained. We have over 90,000, it appears, short-term rentals that people use. And we understand that people travel here, but that means we don't have enough housing for people. So 13,000 people in less than 2 weeks were moved into hotels. We brought all resources to bear. The private sector and philanthropic sector, they raised upwards of $250 million with our help, and we all worked together for that. Many thanks, by the way, to Kaiser and to people on this call. The federal government, FEMA, has been extraordinary. I can't say it's perfect. None of us are perfect. I certainly am far from perfect, but FEMA has stepped in with billions of dollars. The president and I spoke immediately. He approved the major disaster declaration within 6 hours, and so on. American Red Cross has done incredible work for us, getting people now transitioned over to long-term housing. 81% of those that went into hotels are now in long-term housing. We're now launching 1,181 transitional homes. We've acquired some homes. We are in the process of changing our rules on short-term rentals to return 7,000 homes on Maui. That would have never happened. Imagine legislation happening in 2 or 3 months. Never happens. So everyone has done their part. The Hawaiian community at CNHA has been terrific, helping us do a host family program. So it took all of these things. We had to feed people. We had to provide them health care. So the Kaiser team rebuilt their clinic in 5 months. It's incredible, but I will tell you, it cost 300% what it would normally cost to build it. And they decided to do that. Instead of $3 million, they had to spend $9 million to restore healthcare. People were delivering healthcare out of backpacks like, we're accustomed to doing in crises. So everyone stepped in. This is what you have to expect during these kind of crises. Of course, also, even the National Guard had to step in and help us and support, not to provide, like kind of protection or order, but just to help get people moved. So we did all of these things. We are healing. We are also going to make people, we're going to help their families heal with settlements and so on, if they would like to do it immediately rather than waiting many years like it happens. But this is what happens if we allow climate change to roll over us. So my recommendation is, because I know our time will be finite, people should strongly consider having some economic mechanism up front to have a totally dedicated climate fund, so they can be doing fire breaks, fire marshals, hurricane preparedness, all of these things, securing housing for people, having backup plans, because as was mentioned, such a tiny percentage of money goes into climate mitigation and mental health care. That's what these two challenges have in common on the surface. You need resources. And so I will be pressing very hard for climate impact fees, which will be then used to help protect us all. And if we do those kind of things, which will also hopefully decrease our carbon consumption, because people travel a little less and spend a little bit more into these funds, we'll be okay. I mean, at least we'll have a fighting chance. But it is a real uphill battle now because climate impact is upon us.
Thank you so much, Governor. I know the road to recovery is going to be long, and we still have a long way to go. Thank you for everything you've done. My heart goes out to the people in Lahaina and Maui and Hawaii, and honestly, everybody else who's been impacted by climate change. Thank you so much, and have a great rest of the day.
Yeah, again, mahalo for including me.
Thank you, Dr. Shukera and Governor Green. Next, please allow me to introduce our esteemed panel of speakers. We have with us today Dr. Andrea Michelli, Professor of Early Intervention in Mental Health at the Institute of Psychiatry, Psychology, and Neuroscience at King's College London. We have Dr. Sohini Stone, Chief Medical Officer of Global Employee Health at Google, and Dr. Britt Ray, Director of Circle at Stanford Psychiatry. Thrilled to have these panelists, and this panel will be moderated by Jennifer Uchendu, founder of Susty Vibes. So Jennifer, over to you.
Thank you so much, Vetla. It's such a pleasure to be here. As a youth climate activist, I have worked tirelessly to implement several environmental and climate projects at community levels in Nigeria. But a couple of years ago, I and the young people that I work with began to feel what we now know as eco-anxiety, that overwhelming impact of the climate crisis and related environmental issues on our mental health and psychological well-being. I had to make a decision, dig deeper into these problems, or quit altogether my climate activism. And I think this panel is one of the steps in the right direction where we can learn from experts who work within the family, youth, and academia spaces to learn more about this intersection between climate change and mental health. And I'm very pleased to be moderating this panel. I'll start with you, Dr. Michelli. I'm really interested as a researcher and academic, what areas of research are being focused on right now when we think about climate change and mental health? And what exactly are the findings? How useful are they for someone like me, young people within communities? How can this research translate into meaningful data and work that we can use?
Thank you. That's a really important question. There are two current trends in research that I would like to mention. The first trend is a shift from research that traditionally focuses on large groups of people and looks at what's happening with their mental health to a new paradigm where we are looking at individuals. And we are doing this by using an approach called personal sensing or personal exposure. In other words, we are using tools like personal smartphones or sensors to really understand what are the exposures that individuals experience as part of their daily life. We're also looking at possible mitigating factors that are beneficial to these people's mental health. For example, if someone spends a lot of time in nature, we know that this will really help mitigate the impacts of climate change. So we are looking at the individual experience, and this is a big shift from what we have been doing traditionally, where we were looking at large groups of people. And of course, this would mean that the data would be very noisy. And one advantage of focusing on the individual experience is that we can really bring the lived experience to the surface and really try and understand things from the perspective of those who are living, experiencing climate change and mental health issues. So this is a very positive development that is giving us much more granular understanding of how climate change is impacting on mental health. There is a second trend, which I want to discuss briefly, and that's a shift from, it's another shift from simply looking at the association between some climate-related events, for example, the association between extreme heat and poor mental health, towards a new paradigm where we are not simply satisfied with understanding that there is an association, but we want to understand the underlying mechanisms. I will give you an example. We know that people with a pre-existing mental health condition are especially they are especially at risk when it comes to impacts of climate change. For example, when temperatures are in the top 5%, then there is an 8% increase in hospitalizations due to mental health crisis. And most of these people who are being hospitalized are people who have a pre-existing mental illness. So we know that there is an association there, but the key question is, what is the mechanism? So we're trying to move away from simple studies that are simply looking at associations to studies that are looking at the underlying mechanisms. For example, we now understand that people with mental health conditions sometimes take antipsychotic medication or the antidepressant medication that is interfering with their bodily thermoregulation, which means that these people experience ambient heat in a more extreme manner. And that's also why they may struggle with extreme heat more and then may require hospitalization. So this is an example where understanding the underlying mechanisms can help us develop interventions, can help us address the problem. If we don't understand the underlying mechanisms, then it becomes much harder. But having mentioned two very positive trends, two developments in the field that I think are are really improving our understanding. I do want to conclude my answer by mentioning a trend, a development which I feel should happen, should be happening, but it's not actually happening at the moment, or at least it's not happening as much as it should. And what I'm talking about is interventions, solutions. A lot of our academic research is focusing on understanding what's going on, understanding the mechanisms. All of this is really important, but the point is we don't have time to sit and just spend ages trying to understand the mechanisms. We actually need to provide people with practical support. We need to develop and validate practical solutions, practical interventions. And I'm afraid this is an area where, as a clinician and as an academic, I feel we are not doing enough. We need to be braver, we need to be bolder, and we need to be more creative and focus our resources, our creativity into developing actual interventions that will practically make people feel better and support them with the challenge of climate change.
Absolutely. I couldn't agree anymore. I really like how you've zoomed in on the meat of the problem, moving obviously from the trends. Lived experience in this work is super, super critical. Moving away from associations to underlining mechanisms and really saying it as it is. We don't have time. We have a crisis at hand and we need solutions. Thank you so much, Dr. Bocelli. That was so useful and hopeful, particularly for many of us listening here today, calling it out and calling accountability from even researchers and saying we need more interventions and solutions. Thank you again. I will move very quickly to Dr. Britt Ray. As a science communicator, someone who's done a lot of work in the field, in research in this space, you know, as old as we are, we've always heard about the physical impact of the climate crisis, all of the many things that are happening, and very little on this mental health and psychological impact. How do you think as a communicator that we need to elevate the conversation? How do we make this mainstream? Because it's really important. Impacting people on a psychological level, their will and ability to adapt really lies into how the communication is framed. So what are your thoughts on this?
Thanks for the poignant question, Jennifer. I believe there's at least 3 things that we can do to uplift and really highlight the mental health dimension here. Firstly, we now have ample evidence to show that the climate crisis has become the #1 threat to public health this century, and that our health is literally at the mercy of fossil fuels. We know that with the rise of emissions and sea level and carbon concentration in the atmosphere, that this is linked to things like spread of vector-borne diseases and new patterns that we don't understand well, air pollution, which increases illness, malnutrition, water issues, and so on. But what we often forget to appreciate when talking about these physical health impacts is that there's a very well-established bi-directional relationship between physical health and mental health. Unsurprisingly, right? Because as we get physically sicker, our minds, our moods, the ways in which we feel and can navigate the day, that also suffers. And so keeping in mind that there really is no health without mental health is a key aspect of how we can take on the climate dimension to our health. Secondly, I would say that it's also very important to remember that we're not just dealing with a linear relationship here, whereby the direct and indirect stressors of the climate crisis, such as the wildfires and the superstorms and the extreme heat waves and heat domes, affect mental health. It's not just that these impacts overwhelm our communities and stress our health systems and also traumatize us as individuals. It's also that the state and strength of our mental health and well-being directly impacts the climate crisis. What do I mean by that? We know from the UN, the most recent intergovernmental panel on climate change, that we need to bring about rapid and far-reaching changes in all aspects of society. What that amounts to is a lot of work, right? We need to be well enough, our cups need to be full enough, we need to have strong ability to function and take on the work of bringing about the green transition, moving our society towards a green energy economy, alternative forms of how we get our energy, and so on, rewriting policies and collaborating and cooperating in our communities. If we are so focused on our own survival because we are depleted, we are anxious, we are depressed, we are dealing with these mental health impacts, we don't have that extra capacity and bandwidth to take on all that change. So we really need to keep in mind that the ability to protect and promote mental health and emotional psychological resilience is a key climate mitigation and adaptation tool that we must be cognizant of in this. And thirdly, I would say that we want to remember that climate anxiety, thank you for mentioning your own experience with eco or climate anxiety at the beginning of this, Jennifer. You know, the American Psychological Association calls eco anxiety the chronic fear of environmental doom. And despite the clinical sounding name, researchers and clinicians have risen up around the world to say that eco anxiety, or the more narrow form of it, which is climate linked distress, climate anxiety, it's not a pathology, it's not a mental illness, it's actually an appropriate and reasonable to be expected response to a very scary global threat, which is putting a lot of what we love, other people, the more than human world, and so on, future generations in harm's way. So it's a compassionate response, and it marks our care for this threat that we must face. And it's actually an adaptive response. There are now multiple studies which show a strong association between feeling climate or eco anxiety and taking pro-environmental action and climate justice movement building. So in that way, we don't want to see it as a sign of weakness or kind of write it off as catastrophic thinking. When people who we love come to us to voice this climate and eco anxiety, we want to honor the pain as a navigational tool towards what we can do together to mitigate and adapt to this. And I just want to conclude there with a quotation that I find more eloquently puts this than I could ever do justice to. And it's by researchers writing in The Lancet, when they say, recognizing that emotions are often what leads people to act, it is possible that feelings of ecological anxiety and grief, although uncomfortable, are in fact the crucible through which humanity must pass to harness the energy and conviction that are needed for the life-saving changes now required. So in that sense, it becomes a tool in the toolbox for dealing with the world as it is.
Absolutely. Thank you so much. Spoken like a true science communicator, and thanks for that brilliant quote. I really like the framing, you know, our physical health is at the mercy of fossil fuels. And that is the reality, as scary as that sounds. You also bring in a dimension where we can't act for climate and all of the green transition if we don't feel well enough. And this is something that has been coming up a lot with people who do this work, that experience of burnout and overwhelm, even as we continue to research and find ways to, you know, make life better. And then finally, looking at this framing of climate and mental health impacts as necessary, normal, and important, and sort of like the only ways that we can look through a way forward, a path towards adaptation. Thank you so, so much for that very brilliant framing. And really, really lovely to have you here, Dr. Toledo. Looking at everything we've spoken about today, we have a problem at hand, right? A problem that impacts the workforce, that goes beyond health and environment, but also looks at the economy, looks at capacity and ways that we can be productive at work. A very important question would be, how can employers play a role, you know, in supporting the mental health and well-being of their workforce as we navigate the poly crisis, the climate crisis, and all of these intersecting issues coming towards? What are your thoughts on that?
Thank you for having me. As you mentioned, I'm Dr. Ann Toledo. So thank you for that question. You know, I think the helpful thing for what the world has been through is that we have recent models for what we know the workforce and communities need when they're under immense distress. And so I think, you know, looking at some of the pieces that Britt was speaking to around what is it like to value psychological first aid when there's a significant event this is going to vary depending on where in the world you live and what your community's vulnerabilities are, right? And so where I live in Oregon in the United States, some of the risks are things like wildfires, severe air pollution, displacement, loss of farm. In other places in the world, you may be talking about other disasters like flooding or other sources of injury like a major storm. And so one of the things that employers can do is think about what are the systems we can put in place for psychological first aid of a group when an event like that happens. And so there are different models for this. One of the ways that it is done is trying to train a team. It doesn't necessarily have to be a psychiatrist, right? There are many people who can learn community health work in this area around how do you deploy people to support communities or people who are dealing with the acute stress of something that has just occurred to them and trying to plan. And then another piece of that is how do you make sure that, you know, if we're talking coworkers or in a business, right? If I call or one of my teammates calls and says, look, I'm in a wildfire evacuated area. I can't come to work. I'm worried about my home and my whole livelihood. It's really important that people don't feel alone and isolated. And so I think it's important to not underestimate the impact that employers have of letting someone know they're not alone and that they're thought of and community there. And that's a simple part of resilience that I think we saw fail for a lot of people when we were looking at pandemic response, right? And so knowing how important that is, that's a piece. And then I think separately looking at, well, what are the ongoing mental health supports? When something is abruptly happening, a lot of the time a person isn't going to have the emotional or thinking bandwidth to really respond to more than their basic needs, right? So it's like, I can't engage in a deep analysis of my thoughts when I don't have food and I don't have shelter, right? What I need help with are just basic tasks early. And then longer term, something that is commonplace in healthcare organizations and others are programs like Employee Assistance Program, which is confidential psychiatric support, or other advocate resources that are confidential access to mental health supports that are very difficult to access. So if you're an employer or an organization thinking, what could I build up for crisis in general and certainly pertinent to climate crisis, that's where I would be thinking about.
Thank you so much. And I think everything you've said lines up perfectly with what research is finding out. The need to validate these emotions and experiences, the need for spaces, whatever that could look like, the need for community. And I really like that you've brought out the fact that community can also be created within the workforce. So these are very practical tips, I believe, that our audience would find really, really useful. And I thank you for sharing them. And also just being honest and vulnerable enough to say that we are learning and figuring out how to do this from past problems, past crises. And I think that's really useful. I would move on now very quickly to Dr. Stone. I mean, you have a role, massive workforce, massive people to look after, exposed to a lot of information, I would say. What tools, what resources, would you say are available, to help to really build resilience at an organizational level that would not sort of further re-traumatize people, as it were? What are some of the tools that you think are very useful?
Thank you, Jennifer. I'll step back and say that I really appreciate what the other panelists have talked about today in terms of starting with the science and understanding the underlying mechanisms that connect climate and mental health, and then leveraging those to really take evidence-based actions to support people in an organization. Britt mentioned earlier this really important connection between physical health and mental health. And so it's important that we're talking about these topics in a holistic manner and that we're not separating the conversation of physical health on one side, mental health on the other side, but this holistic connection. And so when we think about it from an organizational level, there's two really key pieces of the framework that we bring to the table when we're thinking about how to serve our workforce. One is this idea of needing to have interventions and resources in place for individuals, for teams, and then for the organization. And all of those things have to be considered separately. The same resource or tool that helps an individual, like what Anne just mentioned around EAP, for example, isn't necessarily going to be the thing that is supporting the organization. Leaders and managers need to have tools and resources that help them not just take care of themselves as individual members of the workforce, but how do they then have the language that they need to talk to and support their team members as well, recognizing when their team members are having a need related to mental health, and whether it's tied to climate change or it could be from other underlying causes, helping them access the resources that they need. And then organizations need to be able to really think about mental health and the intersection of climate and mental health, from what is the role that they are playing as an organization in impacting climate? How does that get shared with the workforce that they are part of, and how do they bring their workforce along in that narrative? Because there is a real power, I think this was mentioned earlier, that if you have the ability to be doing something, to be taking action, there is a positive mental health impact versus if you're feeling helpless, if you're feeling like you're not part of some part of an effort to make a difference. That's one piece of it. When we then zoom in a little bit further and thinking about the individual, we really want to think about all the different moments of need that someone may have in terms of their mental health. So we think about that in terms of health promotion. What are the tools and resources that we can put in place to help our workforce promote their health behaviors? These are things that are, we think about in healthcare in pretty much any condition that we talk about: nutrition, movement, sleep, nature. What are the things that we can put in place to really help promote healthy behaviors? Where are there opportunities for prevention? And then we have to be realistic. People will need help and support when it comes to their mental health. How do we make sure that in those moments of need, they have the support that they need, whether it's a crisis, whether it's a personal underlying situation that has happened? And then what is both the resources, but also the environment in which they are working in that allows that support to happen for them? And then finally, we have to think about recovery. After a crisis happens, or after someone has a moment of need or support, there's also the recovery. How do they come back into their, what we would call their baseline day-to-day working? How has that transformed or changed as a result of the crisis? And does the organization have processes in place to have people come back into their day-to-day in a way that doesn't re-aggravate whatever underlying situation they may have been dealing with? There's some great resources out there. May is a really amazing opportunity right now. Many organizations recognize May as a mental health awareness month. And so it's a really wonderful time to be having this conversation with your workforce in a way that is connected, that increases awareness and starts to work toward further reducing stigma, wherever that is for your particular workforce. The other thing that is really great, and something that I'm excited to be part of actually, is that the newly founded National Commission on Climate and Workforce Health, which will be thinking about health broadly and the intersection of health and climate change, will be providing resources over time to help employers and workforces really address some of these issues that have been raised today by my fellow panelists. And so I'm looking forward to all of us being able to continue this journey together, with more of these resources becoming available in the coming months.
Thank you so much, Dr. Stone. Very, very important points. I mean, you've talked about organization support, the need for even helping with decision-making, because that's also a very crucial aspect. Health promotion, looking at resilience from a multidimensional point of view, and then most importantly, recovery. Thank you so much for highlighting those really important areas. So I have a few questions to go around, but I'll really ask that we spend 2 minutes or less just answering and thinking through. Dr. Michelli, I mean, you talked about the need for solutions, right? Is there any chance that something has caught your eye, a strategy, a solution that you've seen in the field that you would like to highlight and point out that could really be effective to help us, address these intersecting issues?
Yeah, thank you for another really important question. Well, I'm part of a research team that is looking at impacts of climate change on the mental health of urban communities, particularly. But we're also looking at what is mitigating these impacts, what is helping these communities. And it's clear to us there is a great resource that has not been exploited yet, is still untapped. And I'm talking about nature. Now, we know we are losing our connection with nature. We're becoming increasingly disconnected from nature, particularly within urban areas. But our work shows that nature can still have a very powerful impact in terms of improving our mental health in individuals. For example, we find that when people spend a bit of time around nature, their mental well-being improves by 81%, and this improvement is still evident several hours later after people have gone back to their homes. But we also find something very interesting, and that's the fact that we don't need to go to a very large park. We don't need to travel somewhere very far to experience the benefits of nature, because often a kind of incidental, everyday encounter with a small pocket of nature, a small pocket area of a few trees, maybe some butterflies, some birds, something on a small scale can still be very impactful, can still lead to observable mental health benefits that are time-lasting. So clearly, nature is an untapped resource. Our recent work is also showing that biodiverse natural environments are especially impactful in terms of improving our mental health. But also, if we take care of nature, we're also addressing the challenge of climate change, because there is a strong interconnection between ecological and human health. And climate change is affecting both. Another example would be when temperatures go up, then this is having a negative impact on biodiversity, but it's also having a negative impact on the mental health of the people who are experiencing the increase in temperature. So I think it's useful to frame all of this in terms of co-benefits. There are nature-based solutions that will help us address the climate change, but will also help us address the mental health aspect. So this is a way of framing the problem that I think is helpful, because there is a lot of negative language around climate change. We need to give up our lifestyle, we need to travel less. Whereas actually there are solutions, nature-based solutions that can help with the climate change crisis, as well as with our mental health. So framing it in terms of co-benefits can be really useful, I think.
Thank you so much. Very well put. A very quick question for you, Dr. Britre. Top of your head, what interdisciplinary approaches or collaborations do you think are useful for this conversation? Where else should we be looking at, and should we be adding to these conversations?
Well, there's so much that we can do there. We saw very clearly with COVID-19 that the treatment gap in many of our countries to be able to support people with mental health challenges is vast. And we need to think very innovatively about how to get people treatment where they are when we don't have enough clinicians and experts. Fortunately, there's a lot of evidence that's already been built up in fields like global mental health, which have been focusing on how do you get mental health care into low resource areas when, let's say, 98% of the population who needs support can't access a clinical psychologist or a psychiatrist. And we can start to expand this through something like task shifting. This is the idea of using lay leaders, people who are not experts, but who are trained with how to use interventions that are stripped of their jargon and simplified to be able to go out into the community and help people who might be similar to them because they share a school or they share a marketplace or they're part of the same background. And a really key, exciting example is something called the Friendship Bench, which many people might be familiar with, which started in Zimbabwe, training grandmothers to sit on benches with people experiencing essentially depression. And the grandmothers, through a variety of conversations, are able to actually help people recover more effectively than had they gone to get primary care, according to what the clinical trial data show. And this is now being expanded and adapted for places like New York City, for New Orleans, which is one of the most climate vulnerable places in the United States, according to the FEMA risk index, and so on. And so that's really exciting, thinking about those kinds of collaborations between community-based organizations, whereby these community lay leaders can be found, and site-specific areas in which we can tap into both the power of the kinds of nature-based solutions and forest bathing that Dr. Michelli rightly pointed out, and also these ways of really addressing the treatment gap by diversifying the pathways through which people get care. But also, we know that the climate crisis is a threat multiplier. It's massively unjust. The people who had the least to do with creating the emissions are getting hit hardest and first by these impacts. And so we really need policies that close health disparities, that provide people access to housing with an ability to cool themselves, for instance, to mitigate some of these health impacts. And I just want to conclude by saying, Dr. Michelli rightly pointed out earlier that we are in a desert right now of evidence around what psychosocial interventions for the mental health impacts of climate change are most effective. I was able to recently contribute to a scoping review on what these interventions might be for climate change and mental health. Hardly any are found in the peer-reviewed literature. They're mainly in the gray, non-peer-reviewed literature. Only 2 had any kind of empirical evaluation component. And so there's an urgent need to build up the strong data sets around what's efficacious, what's acceptable to communities, what's feasible, so that we can unlock supports with power holders, with policymakers, so that we can get things spreading and scaling. However, the need is real. People want help now. And in the last few years, a whole cottage industry of supports has gotten off the ground, even though that evidence is not yet there about what works. And anecdotally, people are getting support through things like the Adaptive Mind. This is an intervention for climate resilience in the workplace that addresses these psychological impacts, led by Susie Moser, a climate adaptation professional, or something like the Good Grief Network, who run a 10-step program modeled off of Alcoholics Anonymous for moving people through climate distress in community. Or the Resilience Project UK, which is created by youth climate justice activists to support their own experiences with burnout and impairing climate anxiety, and so on. And I just want to mention that if anyone is interested to find this cabal of really interesting, innovative community supports that are now getting off the ground, they can go to unthinkable.earth, where we've created a resource hub where people can get plugged into the many different things that people are trying, including the Eco Anxiety Africa project, which Jennifer, your own organization, Susty Vibes, has created to support the African experience with eco-anxiety.
Thank you so much, Dr. Brits. Amazing panel, so much learned. I would quickly hand over to Sweta to take it away. Thank you all so much.
Thank you, Jennifer, and to all the panelists. We have a few minutes left, and so we'd like to take one question from our audience. This question is from Sarah Newman of Climate Mental Health Network. Over to you, Sarah.
We know young people are disproportionately experiencing the mental health impacts of the climate crisis. And I was wondering if you could speak about how and why engaging with young people through intergenerational connections can be beneficial to them to address this. Thanks so much.
So from our panelists, would anybody like to take a crack at that question?
I can, but I just spoke, so I'd love to give the floor to someone else.
Go for it, Dr. Ray.
Okay, sure. Well, thank you for the question, Sarah. We see in our research that climate anxiety is rife in young people, not only because the environment isn't doing well, so to speak, but because their really difficult thoughts and feelings about the climate crisis are significantly associated with a sense of being betrayed by governments, lied to by leaders. We see in a lot of the qualitative work that young people feel like adults have generally left the building on this issue, and that they are essentially caught holding the bag for a crisis that they did not create. And so when they witness that power holders aren't doing what ought to be done, aligning with what climate scientists are saying to safeguard their future, they feel a sense of what's been called institutional betrayal or moral injury, when they're told that they're the great hope to solve the climate crisis, when they wish that they would have more solidarity and partnership right now from all actors, all institutions to solve this crisis before they have to grow up and take it on for the rest of their lives. So a big healing aspect of that comes from intergenerational solidarity, where they can witness, actually, a lot of adults really do care. A lot of people really are stepping into action on this. A lot of institutions are getting it. And so creating spaces, intergenerational conversations, as you mentioned, whereby healing can take place, where meaningful connections can be fostered between adults who are grappling with their own distress about the climate crisis and young people who otherwise feel like they're being belittled, can be a massive form of getting the coalitions together to act in our communities and mitigate further harm.
Thank you so much, Dr. Ray. And to Dr. Toledo, for one final point on this, please go ahead.
Oh, I wanted to highlight what Dr. Ray was talking about globally and around the pediatric population, especially for children, can be either eco-anxiety and more existential, like adults, can also be responding, to actual trauma from something that has happened in their community. And I think around reducing harm and being genuinely helpful, like Dr. Ray was saying, we need more information, and a great source to ask, are the children impacted by this and the young people? I think it's so important not to assume that we know what someone will need or what a community will need. That's very true globally too, with communities we don't know as well. And so in terms of helping, I think there's a huge benefit to be had by asking young populations what they feel would help and making sure we're not making assumptions about what's going to be productive for them.
Thank you, Dr. Toledo, and to Jennifer and all of the panelists. We really appreciate your insights on this. We are now coming to the close of the session. And with that, I will hand it back to Dr. Bishen, who will close out this event with some final reflections. Thank you. Over to you, Dr. Bishen.
Thank you, Sweta. Thank you, Governor Green, our distinguished moderator and panelists, for today's powerful discussion, which links climate change and mental health. The impacts you highlighted just now are far-reaching, and they cut across all sectors of society, whether it's youth, it's old, it's workforce, it's the communities in rural areas, that affects everyone. However, we also heard a resounding message of hope here today. I believe that pairing robust investment in equitable mental health care access with climate adaptation efforts is key here. At the World Economic Forum, we are committed to driving progress on these interconnected global issues. Our Climate and Health Initiative forges collaboration to build health systems, resilience to climate impact, to climate change. And our Mental Health Initiative shapes reform and workplace integration. I encourage you all to join these initiatives, to look at the details of these initiatives on our website. No doubt the road ahead is difficult, but we must elevate mental health across all climate policies and strategies. Each of us has a role to play in fostering more sustainable, climate resilient, and mentally healthier world. Thank you again for our panelists and Kaiser Permanente. I am inspired by our shared commitment to creating a meaningful change here. Thank you very much.
And with that, we close out this event. Thank you all for tuning in. Until next time. Okay, anything